Good morning, everybody. I'm JB Bird at the University of Texas at Austin. Thank you for joining us for this brief call this morning. This will be recorded as usual, and we'll put the recording up online. It'll be in the same box folder where we've been putting B-roll of the administration of the vaccines. You should have the link for that in the advisory we sent. If you need a link for the B-roll, reach out to Ellie Breed in Media Relations. So our goal this morning is just to help our media partners, help you tell the story of the first vaccines administered here in Austin. After some comments from President Hartzell and from Dr. Amy Young of UT Health Austin and Dell Medical School, we will open it up for brief questions from Jonathan Robb and Dr. Terrence Hines. Everybody's titles are in the chat window. So as usual, please be thinking of your questions during the introductory remarks and put them up in the chat window and I will ask them. And if we don't have a lot of questions today, we'll do a brief call because we did just speak with you last week about vaccines, so we don't want to overwhelm you with vaccine talk, but we just wanted to share the exciting news today and make sure you had some good comments to go along with the graphics that we've been sharing online. So with that, let me throw this over to Dr. Amy Young, who has an update for us. Amy?
Thanks so much. So President Hartzell, I'm happy to report that at 8:06 this morning, our team began administering the COVID-19 vaccine. And when I say our team here, it's the Dell Medical School, it's UT Health Austin, in combination with the nursing school, the pharmacy school, and members from University Health Services. So it's been a real team effort. It's a very exciting day. We're in the process of vaccinating our frontline healthcare workers in keeping with state and federal protocols. And we are really excited to continue to learn from this experience and ramp up our capacity as our supplies expand.
Great, thank you, Dr. Young, and welcome everyone. Today, we begin a new phase in our struggle against COVID-19. In addition to social distancing, masking up, and the work of our incredible health professionals, we're now vaccinating people. In short, we're adding a new and decisive tool to our toolkit. We're beginning by vaccinating our frontline healthcare workers. And just to be clear, I'm not getting the vaccine now. I will get it later when it's my turn with everyone else. Right now, we're focused on our frontline healthcare workers. They've been serving the Austin community throughout the pandemic. They also include many of our professional medical students in nursing and Dell Med. These vaccines allow them to continue their service to the community as we move on to the next phase of our battle against COVID. Even though there remains a long road ahead, this is a hopeful moment, one that we've waited nearly a year for. If we stay patient and united, I truly believe we'll look back at this day as a breakthrough moment. While overcoming the pandemic will still take time, we now have more tools to do so. To that end, it's vitally important we all do what we can to help people get vaccinated once supplies ramp up. That way, all of us can get back to a more fuller life lived in person. I want to add that the Pfizer vaccine, along with the Moderna vaccine and several others still being developed, rely upon research and innovation pioneered by scientists working here at the state's flagship university. This is a great source of pride for us, and we're deeply grateful that funding for basic science from the great state of Texas and the federal government helped make today possible. To all of our healthcare workers, medical students, and scientific researchers here at UT, thank you. Your work gives new meaning to our mantra, what starts here changes the world. With that, I'll throw it back to you, Dr. Young.
Thank you, President Hartzell. This is an exciting day. It's the next step in a long journey. I myself am grateful and humbled to have received my vaccine this morning, one among many healthcare workers. Most of all, today represents a great deal of hope, not only for our healthcare providers, but for our community at large. As we mark this important milestone, my thoughts are for the people and the families who have suffered and continue to suffer through this pandemic in so many ways. And on frontline healthcare workers who have given all of their help to their community, and the teams of folks have been behind them, supporting them. Their contributions in total, both quantity and duration, have been truly heroic. And this has been and continues to be a collaborative effort, working with partners across Central Texas and here at UT to keep our communities safe. All of us at the university and across the healthcare community are grateful we can play a part in this new chapter, administering vaccines to frontline healthcare workers and being in a position to expand deployment to the wider population as rapidly as possible. There is still so much that needs to be done. It's very important that we all continue to follow our public health guidelines. We've got to wear our masks. We need to continue to practice social distancing, continue to wash our hands, whether you've had the vaccine or you haven't had the vaccine. As people wait their turn to be able to get the vaccine, we urge continued vigilance with public health measures. This is not the time to let up, but it is a time for us to help celebrate this progress. We look forward to working with the community and alongside our fellow healthcare providers to ramp up delivery of the vaccine in the weeks to come. JB, I'll turn it back to you.
Yeah, thank you, Amy. And so I'll turn it now to questions, if anybody has any questions. And I'm just going to start off with the first one, which is for the people administering, helping us administer this. Do you know when we expect to receive additional vaccines yet? I mean, we're all very excited to see this get kicked off. Jonathan, is that one on your?
We're still in the process of determining when we'll get our next round of vaccines as we evaluate needed supplies for our populations and as the state defines what the next phase will be. So at this time, we don't have a specific timeline, but we're still working through that process.
Great, thank you very much. And I had one other question I received before the call. And again, we'll wrap this call up quickly if there aren't a lot of questions from the media, because we know you want to get on to covering this story. But Dr. Young, I had heard people were wondering how the vaccine is getting administered to medical professionals to help avoid any kind of overlap for people who work in the same clinical setting.
We've been working with our department chairs to make sure that we distribute the vaccine over several days. It's recommended that folks that work in the same critical area are not vaccinated on the same day or a successive day. And so it requires us to spread the vaccine out over several days. And the issue is that everybody has a little bit of a side effect or a body reaction, if you will, to a vaccine, just like you would from flu vaccine or shingles vaccine. And so we want to make sure that we keep our health workforce strong and make sure that we wouldn't take out a whole group of individuals that happen to have a body reaction or a side effect. And we all know, because the data is published at this point, that's a little bit worse after the second booster vaccine than it is the first one. So we're actually having to think not only about today, but 3 weeks from now when folks come back for their second round of vaccine.
Thank you. And a question from Tahara Rahman. How many people have signed up for a shot? And what instructions are they being given upon receiving the shot about monitoring symptoms and follow-up? I think that's for you, Amy, at least the second part, if not the first.
Sure, I can handle that. The system that we have to help people sign up for vaccines has been very much one in which we, as I said before, worked with department chairs and leadership to make sure that we have folks distributed out over several days. When folks come through to get their vaccine, they're given the information from Pfizer about side effects, and then we have an observation room where folks that want to be observed can go and be observed, or if someone's had a reaction from a vaccine, they're there to be observed in that particular space. And that's how we're able to keep the workforce safe.
Great. And is there any waiver being signed on the risks?
There's no consent that's being required to sign for the risk. That's information that came via the state to us.
All right. Well, if there are no further questions, you know we're here, and we've been getting a lot of questions with you and talking a lot with our media partners. We really appreciate you covering this really exciting development for the city. And as our guests have said, there's a lot of work to do, but this is a day to be hopeful for the future. So thank you very much, and we'll take your follow-up questions through media relations. Shireen is on site and working with some of you, I know. So look forward to seeing your stories, and thanks again. We'll see you at the next Zoom briefing. Thank you.
Thank you.
Good morning, everybody. Will Dupree here in the KXAN live studio. There you have it. We have had our first healthcare workers who have received their COVID-19 vaccine here in Austin. These started this morning at Dell Medical School here in downtown Austin, and the officials there at UT Austin were talking about that administering of the shots. I do want to play some video for you all. They were tweeting out images of these first few medical workers getting their vaccine, and we'll walk you through kind of what they've been sharing with us at this time because we were not allowed to be there in person to see this process happen, so we're relying upon UT and Dell Medical School to share some information about how this all played out. So take a look here. These are tweets from Dell Medical School again. So this morning, about an hour ago, they tweeted out these photos saying the first COVID-19 vaccines in Austin are being prepared by UT pharmacy students. UT Health Austin and Dell Med teams are administering to healthcare workers shortly. So these were workers getting the shots ready before they went into workers' arms. So we definitely appreciate those pharmacy students to be able to get this experience, this first row seat to history, really. And then if you take a look down here, they are starting to put shots into arms. There you see one medical worker about to get his shot, and then there's a video right here, a nurse named Stephanie Vasquez. She was one of the first people to get vaccinated today. She said, quote, "I did it because I want to help my community, and someone has to start." So I want you to take a look at this video really quickly. Again, this is a nurse named Stephanie Vasquez getting her COVID-19 vaccine earlier this morning here in Austin. And there is her shot. So I'm going to take that out of full screen so that you all can see other images that we have coming in from UT Dell Med. Again, other photos of another doctor getting his shot right there, as you can see the needle going into the arm, and then other images. The team right there working with other workers today to get their shots. Dr. Amy Young, who you just heard from right here, she's the Chief Clinical Officer at UT Health Austin. She had just said that she also got her shot today, and she just revealed that during that briefing that was held by UT administrators. She did say they are staggering who is getting these shots because there is potentially some side effect, whether that's soreness or fatigue or fever in some cases. That's been widely reported. So they're making sure that if any particular workers have side effects, that they will not be all having to stay at home at one time. So that was a part of it, and they are still rolling out these shots. They received 2,925 yesterday. They are just one of 4 facilities that received vaccines yesterday here in Texas. An additional 19 hospitals and medical facilities will get their shots today. And if you take a look here, UT Health Austin, this is that doctor we just saw a few moments ago. He shared a selfie of the shot going into his arm right there at Dell Medical School earlier this morning. And again, other tweets coming in. There's the pharmacy students again preparing those particular shots. So it's a big day here in Austin. And we are continuing our particular coverage of this momentous day in the fight against COVID-19. Of course, the fight is far from over. The vaccine is still not readily available to anyone who would like to get it. Of course, it's starting out with those medical workers, the people who are putting themselves most at risk of acquiring that disease caused by the novel coronavirus. We will keep covering all aspects of this, so please stay with us. I also want to show you yesterday, this video came in later yesterday afternoon. It's that first shipment of the vaccine arriving at UT Health Austin. There you see the vaccine is stored inside a special container to keep it cold. The vaccine has to be stored at a negative 94 degrees Fahrenheit. to keep it intact before it goes into people's arms. So there you see the shipment coming in. They're moving it to another refrigerator, a special one to keep the vaccine at the appropriate temperature. But we just wanted to share this video because UT Health Austin shared it with us yesterday afternoon. And we do have this on our website as well. So again, we are still covering all aspects of this. The first healthcare workers are receiving their COVID-19 vaccine at UT Health Austin and Dell Medical School. We just want to pass along that headline. We do have more reporting about this over on our website. That's kxan.com and the KXAN News app, so please download that if you've not done so already. Once again, I'm Will Dupree here in the KXAN Live studio. Thanks so much for watching our stream. We will see you back here throughout the day with additional updates. Please stay with us. Everyone, as I always say, stay healthy, stay safe, and take care.